we are all here to learn how to enter data into CSIS. Some of this information is going to, you'll have this recording after this so you can rewatch it. And we might be able to put together a step-by-step for you guys, because sometimes this is done, it's done differently than some of the other projects in CSIS, because your clients are coming in and then we're going to be adding the head of household and then adding the additional household members when the client comes in for their appointment. Correct, Amy?
That is correct.
Thank you. So we're going to act as if I'm going to go into a backdate mode of last week to add a client, but you guys won't be doing this initially. You guys initially will be, what was last Wednesday is when you guys got that money, right? So, okay. So I'm going to set this backdate mode just so I can enter our client based on what you guys receive from, as far as I'm aware, the Survey Monkey, or that's how clients are registered to attend or to get appointments set up. And then you guys are able to determine eligibility at the actual appointment. Correct?
Correct.
Okay, great. So the first thing that we should always do, because some of our clients might have a record of
they already might be in the system.
Yes, exactly. I'm sorry. I wish I could mute the notification telling me there's people waiting in the lobby. I don't.
I'm actually entering them, Lauren, okay. So you can concentrate on what you're doing. And
thank you very much. Okay, so yes, you always want a client search, because some of our clients may have historical information and may already have a client profile set up in CSIS. So I'm going to search for our first client. His name is Brandon Test. And we see that Brandon's actually already created. Maybe he had received a service back in the day, and we don't have to start a new client with this, and cannot see screen just showing participants' initials. Kathleen, I would, is anybody else having that problem? Can you see my screen, everybody? Kathleen, I would leave and come back. So if we already have a client that is already created, we can simply click on the client and then from here we can see some of the basic information that Brandon's provided. We want to enter him into our program to show the continuum of care. If Brandon were to go to another project, we want to show the continuum of care that he's already working with you guys. So I'm going to act as this is not here. And then we're going to add an entry. So we see here, Brandon is not working in any other project.
I'll take care of this.
We're going to add entry. And we're going to select our type. Your type speaks to the funding source, essentially. We're going to select basic and save and continue. If your project was coming from a different funding source, so let's say we accidentally hit the wrong funding source. Let's say we accidentally did this. Okay. We're not going to do that. We're just going to go through for Brandon, because you guys are entering Brandon into the project. This is not his first, he's not at the appointment to collect this information. So when you guys are in this project and when you're entering him into this project, we're going to identify to the best of our ability this information. You guys are FL 519, but we don't know where the client stayed last night. So we have to answer data not collected, data not collected. Correct, Amy?
Correct.
This is the initial intake. So when you guys are initially entering the client into the program, we are going to respond with data not collected. And you can identify these two because you know that the head of household is the one that's registering through the SurveyMonkey and where you got that information. And then the client location, this is your basic drop down. You don't have any other option. That's your COC number. So from here, we can simply save and exit. So now we are showing the entire continuum that this client was created, that this client is in your project and has an appointment coming up. So if someone else from another service provider, if Brandon, you know, just like sometimes we can client or we can provider shop sometimes, right? Because we're the same thing. You just want to get whatever you can for with as little hassle as possible. So we're going to show the entire COC that this client is in this project. I'm sorry. I have to keep everybody. Yes, Carlos.
I have a question.
Sure.
From previous training, and we have been trained not to use the data not collected for the reason being that if and when we run a data completeness report, this will come up as a null. So I can understand why it is that it says data not collected because the person is not there in front of you. But are you saying that going forward that we are supposed to use, our case managers and staff are supposed to use the data not collected?
Absolutely not. I am saying that this entry is before we actually meet with the client to collect that information. So this information is going to be entered for now as data not collected because you aren't collecting that data, right? We're entering these clients based off of the information provided in the SurveyMonkey registration. So you don't have very much information to go off of past that information on that registration form. Like it doesn't ask on that SurveyMonkey the disabilities or income. Or even, I don't know if it does, but if it does, if you have the client's prior living situation or where did you stay last night, that would be excellent. But at this point, we are just entering this client into this project. And then upon the client coming in for the appointment, we are going to add the additional household members and answer all of these questions for this client and the additional household members. And I'm going to walk you guys through that. That's going to be the biggest part of our training today.
Thank you.
Yes, of course. We never really want to use data not collected. The only time we use data not collected is obviously when children and the veteran question, and when we have the intention to go back and eventually collect that data, like in street outreach programs or in this program. So we're going to use data not collected for now. This is not going to be our end response. Amy?
Yes. Okay. I'm sorry. I'm trying to, Brandon's emailing me. I'm trying to work with Kathleen here.
No worries. I just want to make sure. I wasn't sure if you wanted to say something. You're good.
No, that's correct. Data is, if you do not have the data at the intake, then data not collected is the correct answer. But once you get the data, this information should be updated at that point.
Absolutely. And that's what we're going to do in just a moment. We're going to, because also the thing about your project and this specific project is you guys are entering clients from a SurveyMonkey registration. you're setting up appointments and you're creating the client from that registration. So let's actually start from that point where maybe it isn't Brandon Test and Kim Kardashian has sent you a registration form and she needs some assistance. We're going to say full name reported and fill out as much information in here as possible that's on your registration form. So if we have our social security number, and we can identify this information. We can search, and then there's no matches. So we need to create a new client. We always want to search because obviously we saw that Brandon had a previous entry into the project. So we could use his historical profile. From there, we're going to add new client with this information because we didn't have any other Kim Kardashians in our system. We're going to add new client. And I'm using backdate mode. You guys will not, because when you guys enter these clients and create these basic client profiles, you're doing that live. I'm setting a backdate because I'm training and I need to show how to go back and do this stuff. So we're going to do this and add client only. Okay. And same thing. We're creating just Kim's profile with the information that's provided on our SurveyMonkey. We're going to add her entry exit, basic, save and continue, and then fill out any of this information that was provided by the client when registering with that SurveyMonkey. Same thing. We know Kim's the head of household because that's who's registering for the assistance. We don't know the client's prior living situation yet. We will, but we don't know it just yet. We'll find out that information at the time of her appointment. So we're responding all of this for now as this information. If you have the client's residence or permanent address, maybe her phone number, you can add that information now. This would be helpful, I feel, for you guys to add this information if it was provided. Maybe she registered with her email and she provided her phone number because you guys had to call her to set up an appointment, right? This will be helpful for you guys if maybe Kim doesn't show up for her first appointment and you have to circle back and you don't want to have to shift through thousands of client records and SurveyMonkey registrations. We can just add that information here and now. We're going to save and exit. So like before, we can now show the entire COC. Kim is registered for this project. She is going to enter this project from this provider. So if Kim were to get register with another provider, that provider would see this information already in the system. That's really the main goal today, is to communicate that you guys will all be able to see each other's work and see who's working with which client. That's a great benefit of CSIS, is the client sharing information and the ability to see what projects the client is working in, so not to duplicate efforts. Okay, so then, Amy?
I'm sorry. Can you show them, because a lot of them are working with multiple programs, how they need to get into this before you create the family? How they can access this, each of their programs? Like right now you're shadowing Danielle, but Danielle has access to multiple programs. I just want to make sure that they know they need to EDA into this. You may have already gone over it.
Yes, I did not. Thank you so much, Amy. So the first thing when we're creating our clients, the very first thing, when you're entering data in CSIS, the very first thing we always want to do, because you guys have so many projects that you're working in, this is normally my very first step. I'm so sorry. I jumped the gun on the EDA. The very first thing you guys want to ask yourselves, what am I doing in here? Right? You guys have so many projects. You have so many clients that you're working with that it is hard. I don't know about you guys, but when I walk into the other room, I can't remember why I walked in there. For me, I have to remind myself when I log into CSIS, what am I doing in here? And to answer that question, if you say, what am I doing in here? And it's anything other than your project that's listed here, all of you, as far as I know, will be entering data as this program. This is a new program for you guys to enter data as. So we have to EDA into that right project. We have to show this system that we are entering data as this Pasco County Human Services Community Heart Program. We have to click that pencil or that plus sign to show the system, hey, I'm entering data as Pasco County Human Services Community Heart. This is what I'm entering data as. All of you, as soon as you work in CSIS and you're working in this project, you must EDA into this project. So when we log in, we ask ourselves, what am I doing in here? We make sure that we're entering data as Pasco County Community Heart, and we go from there. Like I said earlier, ideally we would be entering data live, but for purposes of this training, I did backdate. So Kim, we entered Kim into the project, and she's here at the appointment, right? So we need to create the household that Kim is a part of. She has herself, and I don't know if anybody's up on pop culture, but Kim and Kanye separated. So, but we're going to pretend that Kim's still, putting up with Kanye's business. They are a household and they have a daughter, North. In the interest of time, we're not going to enter all 4 of her kids. We're going to create Kim, Kanye, and their daughter, Northwest. But to show the system that we are creating Kim, we have to backdate to create that household. So we have to backdate that client's information to create a household. Amy?
Yeah, I'm sorry. Yes, no, I'm answering questions here.
No, you're fine. I'm just making sure.
Oh, okay.
Can you please?
I'll go ahead and I'm going to post the Accurum list. That's fine.
Absolutely.
And Kathleen, we're going to have to set up a time after. We will be sending out this recording, but it sounds like it's a computer setting that you're not able to be able to see. So you and I can work on this after. If you want to go ahead and listen, please go ahead, and we'll be sending out this recording later so that you'll be able to actually view it. Okay, I'm sorry, go ahead.
You're fine. Thank you. Thank you for answering the questions too. So we need to create Kim's household. So we created her entry. We see this. The reason we have to backdate creating a household is because we need to show that these household members are added into this program. We need to show the system that. So we need to click on our households tab.
And they need to be associated the day of. They cannot be associated at a later date. So therefore you have to backdate.
Thank you.
I'm sorry.
So we click on our household tab. And we can search existing households. We can start a new household. We're going to start a new household. We need to couple, female single parent, foster parent, and we're in a 2-parent family. So we have Kanye. And we will be able to fill all this information out with Kanye.
It's not letting me do it.
Okay, so we've populated all this information for Kanye. We're going to search. There's no Kanye in the system. Add new client. This is asking, are you sure? Yes. And then we're going to search for North. Oops. I accidentally put data not collected. So here we are creating the entire household. We're creating profiles for North and Kanye. Search, add new client. Okay. So from here, we're going to continue. And we can create our household. We have to identify who is the head of household, and that is Kim. And when you identify Kim as the head of household, you can watch this information, the relationship, auto-populate. We're going to say yes. And then we have to identify Kanye's relationship to Kim and North's relationship to Kim. So now we've created our household. And now we can ask these questions. We can answer, where did you stay last night? And fortunately for you guys, to be eligible for this project, you're really looking at anywhere from 2 to 5 prior living situations. So if anybody can type in the chat, what does the question prior living situation, what question are we asking the client? There's one very specific question that we should be asking instead of prior living situation. Does anybody know what that is? You can either raise your hand or you can type. Thank you, Natasha. Ooh, keep them coming. Great. Thank you, Shannon. Thank you, Lisa. Hopefully, I have more people chatting. We've got 45 people on the call. There's 3 responses. This is how I can tell who's paying attention. No. Yes, it is. Where did you stay? Where did you stay last night? Where did you sleep last night? Absolutely. Thank you, Shannon, Natasha, Tracy, Lisa. If I had virtual Smarties, I would be throwing them out.
I just shared a file. Hopefully everybody got that for the acronyms and what the PCA means.
Great. Thank you, Amy. All right. Thank you, Barry, Jacqueline, Priscilla, Tracy, Andrea. So where did you stay last night? So like I was saying, with this project, for eligibility purposes, we're really narrowed down to those living situations of rental by client, owned by client. We're really looking at those specific rental by client, no ongoing housing subsidy, and rent owned by client with no ongoing housing subsidy. I don't know that your program, maybe the Community Heart can pay for arrears in public housing or with vouchers. That's just dependent on, I know that ESG can pay up to 6 months of arrears for public housing or voucher program arrears. So we're going to say that Kim, go ahead.
Lauren, this program in particular is not covering mortgage, so owned by client would not really participate or be covered.
Qualify,
it is
yeah.
a rental. And each of their programs are set up to show rental only, rental assistance only, whether it be back arrears or forward. That's the
In the services?
Yeah. Yes.
Okay, great. So you guys are really, I mean, there's not a lot of wiggle room here, really. So that's great. I mean, some of the biggest data consistency issues that we find are in this prior living situation. So it's almost like you get a hall pass. Like, you know, the client's going to most likely be coming from a rental by client for them to even be eligible for this project. And then your COVID-19 information. It's likely that the client, yes, has been affected by the COVID-19 pandemic. And then we would simply identify what the contributing reason is. Unable to pay rent, loss of job, illness of a family member, illness. So these are all really, we're kind of what comes first, chicken or the egg kind of thing. But maybe the client didn't lose their job, their hours were cut, which made them unable to pay their rent. So this is how we're going to respond. From here, we're going to now answer these questions.
Can I break in? I'm sorry. So I do have the HUD verification there. However, they do not collect the disability type. But if they could, ask it while they're there, that's great. If they don't want to respond to what type of disability, then that is okay as well. The question, does the client have a disabling condition, does need to be answered yes or no. The HUD verification piece, if we could get that answered, that would definitely help, but it is not a mandate.
Great, thank you, Amy. So historically, we request/require, regardless of the project,
yes,
that our HUD verifications be completed. Because when we're entering data in HMIS, and pardon me for saying CSIS, it's still an ebb and flow for me that we have two systems, and one is HMIS, one is CSIS. They are the same thing. When entering data in HMIS, we are telling the client's story, right? We are saying that Kim Kardashian stayed in a rental by client. She's coming into this project because COVID-19 affected her ability to pay her rent. And these are her disabilities, and this is her income. When we're telling a complete picture, we, like Amy said, would like for you all to enter this information so that if Kim were to identify as having a disabling condition, we would be able to identify what type of disabling condition that is. So when we're asking, does the client have a disabling condition? The client says yes or no. We would want to make sure that we collect just a little bit more data to provide that complete picture. Because maybe Kim said no, but then when we go through the entire list, she identifies that she does in fact have a mental health disorder. So we're going to say yes here and save and exit. But like Amy said, it is not required. But by opening up those questions to the HUD verification, We actually did find out that Kim does have a disabling condition. She does have a mental health disorder. From here, we can go down and if you're able to, we can ask, what's your percentage of AMI? Does this project require the clients to be less than 30, 30 to 50, under 50, or greater than 50? Is there any eligibility on AMI?
Yes, there is.
And what is that?
Yeah, I believe that they are starting with the less than 50, the lower portion,
Okay.
and I believe it goes up to 80%.
Oh, great.
Danielle is on the call. Danielle, I believe Danielle's on the call from Pasco County Human Services.
That's fine. We can put, this is actually less than with the size of the household.
Yeah.
So we can identify her percentage of AMI and the total monthly income and whether she receives income from any source. This still makes her eligible because, as you all know, we will be emailing everything out to you guys. Jacqueline, yes, what's your question?
I need on this number one, I have two concerns. When you put data not collected, isn't it better to leave it blank? Because some data entry people usually disregard that data not collected. They don't see it as something that they have to correct or update. And number two, do we ask the clients their AMI, or based on what they tell us about their income, you work out the AMI?
We will send out an AMI. It's effective as of April 2020, but that's something that's on my task list, and I will make it a priority to do today, to send you guys with these other, this recording. I'm going to try and just create a step-by-step for you guys to follow along and have reference to by the end of the day. And then also the acronym list and an AMI. You will look at the client's AMI. Typically, clients in a household of 2 or more making less than $1,500 are within that less than 30% AMI.
Great.
So,
Sorry.
Taking my question, I do appreciate it. I was always wondering, how do you work out that AMI? I do appreciate that. Thank you.
Kim, and if Kim and Kanye both have income, you would be able to get the total household AMI from the household screen, and we can show you that afterwards.
Yeah,
right there.
Right up here. Once we fill out Kanye's information, we'll be able to, but you'll have a piece of paper that you can refer back to for your reference. The data not collected question, and Jacqueline, I totally see what you're saying, that when people see that there's data in there, they're like, oh, well, I don't have to answer it, even though it's not answered. And the best I can say is, everybody on this call, if you see data not collected, that is not a good response. We need to answer that question. I can only, hope that when people see data not collected, that they say, oh, I have to answer that either yes or no. We're all in this training together. We're all learning this information at the same time. So hopefully we're all able to, when we see data not collected, we are saying, oh, that answer needs to either be yes or no, because we know data not collected is not a sufficient answer, especially when we're having an appointment and we're talking with the client. But thank you. Any other questions? I'm happy to respond, because I'm sure you guys have a lot of what questions going on in your head. So please do not hesitate to reach out. The reason we can't leave it blank, honestly, is because the system won't let you. So that's just the reality of it. It will keep asking you to answer that question, and it will continue. It won't let you pursue to the next screen. So that's why we say have some data in here, and then upon appointment, answer yes or no. Same thing with your HUD verification. I mean, again, Amy said, you guys are not collecting this information. I think it's helpful to tell that complete picture. You guys, you know.
You are collecting the HUD verification on the income piece, just not on the requirement is not on the disability.
Okay.
Yeah.
So your income
yes.
is required. Great. So when we go to our income, it is required to have the data, the HUD verification, that little red triangle, have all of these responses, all of these types have either a yes or no. So go down the list with the client. We're saying that Kim's currently on unemployment insurance and she's making $1,400 a month. So that is what we are saying. So all of this is complete. We're going to save and exit. We added the client's contact and housing information earlier, but we just added her cell phone and her email. So we want to make sure that we fill out the rest of this.
So I was correct. It is 80%. They cannot exceed. So when you're looking at the income in the AMI for the family is 50%, of course they would be eligible. Anything over 80, they are not eligible.
Great. Thank you, Amy. So we are going to do our zip code of 33523 and apply zip code information. So now we have Kim's full address in here, her phone number and email, and we can save. If it was provided, we can add a emergency contact. But from here, we're going to save. And then we need to populate our information for Kanye and North. So we can add our household data so that all of the information under Kim's household living situation populates to Kanye and North's. It's just a little step saver for you guys. Save and exit. And then we're going to go through and respond with Kanye and with North. I'm going to edit his military veteran status because I accidentally did data not collected. And we need a note. From here, we're going to go through. Always identify your relationship to head of household. That does not auto-populate for each of your household members. So we know that he is Kim's spouse or partner. And we're going to go through the list. COVID-19 information. This is ideally for your head of household, but if you're in there, you can respond as well. Disabling condition, yes or no. We're going to say yes, that Kanye is suffering from his bipolar disorder. Click right here. So I auto-populate to no because it's just a time saver. You get all these in one fell swoop, move from incomplete to no. You can do that in the income bracket and then review with the client each of these disability types. We're going to save and exit. And now we have complete, current, consistent, and correct information. Same with our income. We're going to say that Kanye is not currently working right now. And we're going to HUD verify. Again, you have to do your HUD verification for the income. For the disability, it's not required, but your income is required. I just want to make that clear. We're going to save and exit. And same thing, you can add Kanye's information, but it's under the client, the head of household. So it's really, an internal decision. And then we'll go through North. Click on North. We see that her information has been updated. We want to make sure, Christina, you need to. relationship to head of household. She is the daughter, so head of household's child. And they came from the same place. We'll go to her disability. We say no. HUD verification, yes or no. No. And income. We say no, save and exit. Hey, Amy, what if one of the children is getting SSDI? Who do we put that under?
That would go under the head of household, so it would go under Kim. Anytime a child is receiving SSDI or other type of income of that source, that always goes under the primary parent, because actually it is the parent that is receiving it on behalf of the child.
Excellent. Thank you so much. That's a common question that we have that people don't, we don't think to ask it until we're in the moment. And Kim saying, oh, well, North receives, you know, yes, Jacqueline, go ahead.
When that happens, do we put a note in there somewhere to indicate that is the child? As I said before, some people tend to disregard the data that is there because I don't know, they're so busy. So when we put the disability under the parent, the head of household, what it is for the child, do we put a note somewhere? And where?
I mean, that I would think that that would be helpful. So if, let's say that happened and we were saying, does North have any income? And Kim's like, actually, yeah, she receives SSDI. So let's go through, because we're still creating the household and we just got this information, and edit this SSDI. And we can say that she receives $250 for North disability. But to your point, you don't want to, if this was already created, you don't want to overwrite somebody else's entry or somebody else's record, but you created this just now. So you're editing your data. If this client was previously, this information was previously in there, you would do it in a different way, but we're going to do it just this way. We're going to save. But to your point, that whoever works with Kim next will have to look at this SSDI record set and click that pencil. You could write a note on the client profile, but I'm trying to think of when that would be necessary. Jacqueline, do you have an example of when that would be necessary?
No, because when we are entering the client for the first time and we put that note, everybody who comes in will see it. So we don't have to interfere.
Yeah, so if you see information and data entered here and you want to review it, if you guys add a note there, then everybody can see that and know that that's for North's disability.
Yeah.
Go ahead.
This is actually something that we go over in basic skills in more depth. We have another basic skills coming up. If you would like to attend that, you can reach out here to Lauren, but she explains how to create one, how to create an entry into income, how to end one correctly and start a new one. So this is just a basic skills as far as program specific, but if you want to get into more of the income pieces and these sub-assessments, please plan to attend Lauren's basic skills. I think you have one next week.
The 3rd, we're switching them to Wednesdays in March.
Okay.
Yeah, so Wednesday the 3rd. Feel free to give me a call or email preferably. Okay, so we updated Kim's SSDI to reflect North's income. We're going to save and exit. We've created the household. So we've got our household. Now we need to enter the whole household in the family or in the project, sorry. To do that, we're going to click this pencil. of the project start date. And we need to, you see how it says here, no household members were originally associated. Well, we need to include those additional household members. This is why it's so important to backdate the time of the client's entry. We're going to hit continue, because if we created Kanye and North for as of this day, the 23rd, these clients would not exist in the system on the date that they entered, or that Kim entered the program. They existed on the 23rd. This is very hard. I want to almost show you an example of why.
It's because it goes forward and does not go back.
It does not go backwards.
So if we had entered the information as of the 23rd, the information was not there on the 17th. So
exactly.
that's why you want to make sure that you backdate to the entry date of the primary client when you're creating the household, so that you can include them in the original entry of the client, primary client.
So we're going to continue. Does anybody have any questions? I feel like if I was on y'all's end, that would just be like flying over my head.
See, with the project start date, if they were created after, you would see join the household on the 23rd. So therefore, they would not be eligible on the 17th. But by backdating, you can see they joined the household on the 17th and now are eligible to be part of that project on the 17th.
We're going to save and continue.
Am I giving too much information?
No, you're fine. So from here, it's that point in time. And I know that flew over my head for like the first 2 years of my work. Okay, so we've got Kim. We already did our intake with Kim when we were doing creating the household. We just want to review and make sure all the information is complete, current, consistent, and correct. We're going to look through each member of the household real quick, just to make sure that all this data is here. If this data is not here, it has to do with that time in which the clients were created. So we have to be very mindful of the time we're creating the clients and the day we're creating our clients. So we see all this, everything's complete, everything's current, everything's correct. We're going to save and exit. So now the entire family is in this project at the same time.
And now we can give them a service.
Great. Let's end their homelessness. Let's end their crisis, right? How good does that feel? That they didn't know what they were going to do until your project came along, and really you guys are ending homelessness.
You're muted again.
Thank you. I don't understand why I'm like not even touching the mouse on that screen. You guys are ending homelessness. You are preventing homelessness. This family was in crisis mode, didn't know how they were going to pay their bills until they came into your office, and you guys are able to provide this funding to prevent and end their homelessness. Amy, are we adding the entire household to the service?
Yes, we are.
All right, so the best way to add the entire household is click on that top box. And Kim and Kanye and North are also selected. If we don't make sure the entire household is clicked, we're missing out the services. We provided the entire service to the household, the entire household. So we just click on that top box and make sure we provide that household this service. So as you see, you have your drop downs here. We are limited to rental assistance payment, or we can still pay water and power?
Water and electric.
Okay, water, electric, whatever they need. Give them anything they need so they can go home and rest easy knowing that they are fully paid up in their rental arrears. From here, we're going to make sure that our provider is correct. We always want to make sure our provider is correct. If we are in the wrong service provider, if the wrong service provider shows up here, you've entered into the wrong project. We want to be very mindful of that. Always make sure that you are entering data as EDA, entering data as the correct project, and that service is being provided under that project.
And everybody's has their service provider is their first name. And then also it says Pasco Heart. This is our test site, which was not updated, but it will read their agency and then Pasco Heart at the end there.
Excellent. So please be mindful, make sure and if this was in the wrong project, if it didn't show us this project, we cannot click the pencil and choose a different from the drop down. We have to exit from this service and make sure we are entering data as that project. We can't manually change it because they won't talk to each other. It will create a reporting nightmare and a lot of work for you to do in the long run. So when you guys
happy.
when you guys are working in this project, be patient with yourselves. We are all learning. I mean, you're ending homelessness with the funds associated with the project. Take your time. Be patient with yourselves. Don't rush through it. Just like anything else, when you rush through things, you miss things. We make mistakes, and then we will end up having to go back and correct them to make sure everything is set up and in line. So please take your time. I'm going to take the time today, this afternoon, to ensure that you guys have a step-by-step where you can literally read step one, create client, and then all the way to the end of exiting the client. So you have something that you can look at to refer back to after this training today. So we're going to go down, and are we applying funds to this service, Amy?
Yes, everybody has a funding source called Pasco Heart. I'm still cleaning up their funding sources so they can search for it at the top there. And you will see community, it'll read Pasco Heart, but that's Community Heart that we have right here because it's a demo site.
So we're going to hit that plus sign. So just search. It'll say Pasco Heart. You hit that plus sign. And then you enter the amount. What's the total arrears that they can go back?
That I don't have an amount on as far as how many months they can go back.
Well, so typically what I've been finding is that it's up to 6 months arrears. So let's say 6 times 8, that their rent was $800, they're in $4,800 arrears. That's what ESG has been doing. So we'll go off that. It might be more, it might be less. You will put whatever the client is eligible for to receive, whatever the amount is that you will be providing.
We're going to is saying up to 12 months. So, she's out of the Pasco County. So we'll say up to 12 months.
Okay. So yeah, this is going to be, I mean, can you imagine feeling, I don't know about any of you guys, but I know when I've been arreared a couple $100 and it feels like your entire world is coming on top of you. So this is just an amazing service that you guys are providing. You are really, really impacting lives and ending that crisis mode for our clients. So when you add that funding source, you're going to, click, I'll just walk through that again so everybody sees it. Go back and go a little slower. We add funding source. We're just going to search Pasco. It'll say Pasco Heart. We hit that plus sign. Type in the amount of the service that you guys are providing. Scroll down here. We always want to close our need because we're meeting that need. So you always want to close your need. Just close the loop. You're going to say that you fully met it. And then we save and exit. We've shown the system now that you've provided $4,800 in rental assistance. From here, yes, Amy.
Sorry, there was a question about, and I did type in the comments, but there was a question about the type of entry exit. This is not a HUD-funded program or a state ESG. This is coming from the Treasury. So therefore, we do not use in the entry exit HUD. It is a basic type of program. And that is, thank you for going there, Lauren. If you can show where it says basic.
Right.
It has been set up according to the funding, and I just wanted to let you know that that's the way it is here. And no,
Sarah,
we should
we
not
wouldn't
change
change that because
No.
it's not being reported to HUD.
Right.
That when you think of your type, we want to think of who this money is getting reported. Who is the money coming from? Is it coming from HUD? No, it's coming from the Treasury Department. If it's coming from like your ESG project, those are HUD funded projects. I'm even gonna, if I do HUD here,
You will see that there's
this is why. So if you guys were to, and that's what I tried to show earlier, but it was not cooperating with me. So if you guys ever add your entry into this project and select the type of HUD, your assessment will not appear. We have made this, it's not a hall pass. It's not, oh, you don't have to fill out an assessment. Awesome. No, you have to make sure that you are in the correct type, which is basic, and that will be for everybody, regardless of if you're at ACE or if you're at the Pasco County Human Services, your type will be basic. If you ever accidentally go into that HUD type, you simply just go up to the top here, hit update, and now your questions appear. So yeah, if you're used to using HUD funding or HUD types, I'm just going to delete that real quick. That's because that's where your funding's coming from. Just like if you were working in a veteran project, your type would come from the VA. If you have SSVF funding at your agency, your type speaks to where the dollars are coming from. And then that allows us to send in reports, and I can get really super technical, CSV exports to repositories.
And I work with, when there is a form that I use, and I work with the program managers and set it up according to what the funding source is, because each funding source has its own set of questions as well as the universal data elements that HUD requires.
Absolutely. So we provided our service. Are we exiting the client same day?
Yes, we are.
Excellent. So let's exit Kim and Kanye. We're still in that backdate mode. There was confusing interchange. Thank you. Excellent. We're still in that backdate mode. We need to make sure we select the entire household. This is one of those little things that if we're not taking our time, if we're like exit and then you go on to the next page, Kanye and North were not selected. So you're going to end up having to go back and exit them at another date because it's going to show they're still in the project. So always be very mindful with yourself. Take your time. Our exit date is that back date. Even what if Kim and Kanye came in on the 23rd? What if they came in today and we provided the service today?
If you provided the service today, then that's when you wanted to exit them. But you provided the service on the 17th, so you're going to exit them on the 17th. Excellent. Because it is basically a service only and not a case management.
Excellent. So let's click that 2-parent family. Where are they going? They're going back home. You can add a little note. I always recommend, this is again totally internal, but in my many, many years of working in monitoring projects and working with collaboratively with other agencies, little notes go a very long way. So even if you provided that service and we can see that in there, client, just a little note, but again, it's extra, but it goes a long way. Maybe 3 years from now, who knows? It's just a little note that goes a very long way.
Well, it
We're
also
gonna-
helps if, for instance, they did not receive
Yeah.
the funding, and the reason they were leaving instead of completing program was because they were ineligible.
Yeah.
So by putting that note right there, you can see while they were ineligible, they were over income, and that was the reason why. And that's important because you may be getting some, you as an agency may be receiving a referral from another agency that maybe just is overwhelmed with applications, and they may be asking you to take one. And you can see that the program has been started, there's no exit date, or if there was an exit date, it's important to look to see, was it completed, or was it a transfer, or was it they were just not eligible? So when you're first going into the program after you create, you need to make sure that you do not duplicate an entry exit or service for somebody. You're going to look at that on the summary page.
Yeah, we're going to look right here when we first get a referral for a client. We can look to see did they enter the project? Did they exit the project? Why did they exit the project? Or did they get a service? We look at that right here. We can see here, we can see the more detail in our service transactions right here. Well, it looks like you guys just came in to Pasco County, and we provided you the 4,800 in rental assistance. What else? We already provided this. We already prevented your homelessness. We can't super prevent your homelessness. We definitely want to avoid duplicating efforts, duplicating services. You always want to review this information. Sorry, another question. Never apologize for asking questions. We are not seeing addresses, other contact information, or notes for services for previous clients in HMIS. Is there a reason that is not showing up now?
Actually, they do see that if they go to client information. All programs have been set up so if you go to the client profile, and if you scroll down, there is the information, and you will not have to go into any entry exit to get a client's residence or phone number or emergency contacts.
Sarah, were you maybe looking on a different screen? It was not showing up actually. So we'll be able to troubleshoot that with a specific instance. If you have a client ID, and after the training, we can you can either hang on the line and I can go into your live site and shadow you and see what's going on. So let's just do that.
It may be, Lauren, it may be because I'm still working on setting up all of the agency profiles for all of the projects that are in. I'm about halfway finished now.
It's a long process.
Yes, but it will display in their new project that I've created.
So we went through, no addresses showed up on that screen for previous clients when clients were searched and were already in the again, so this is something, if you guys want to hang on the line after training, I definitely can troubleshoot that and identify why after the training. If you can have a specific client ID and project you're talking about, so we can go specifically and I can see and diagnose that after training for sure.
They were also not using the correct sub-assessment for addresses, so that may be an issue why.
Okay,
we
will see.
Updated.
So we added the clients into the program. We provided that we entered the basic information for the client. Then when the household came in, we added the household, created that household for that same date. Then we provided the service, and we exited the clients. Is there anything else?
No, I mean, that is it. And hopefully, if they have any questions, can reach out to you or myself concerning any of the entry into HMIS. I know this afternoon they have a training with the Pasco County Community Development to talk about invoicing and how to submit those. So please plan to attend or reach out to them if you did not receive a link and are in charge of invoicing for this funding source.
That's a big project, which if if your reports are and your invoicing is anything like the invoicing we do for ESG, that it all goes back to what's entered into CSIS. All of this data is used to support your invoices. So this is why we have to be very careful. We have to be very mindful. We have to be very patient with ourselves when we're entering data. I know I didn't get my degree in IT or system administration, so this was all new to me when I was first starting. The way many were trained. Well, thank you, Priscilla. We really appreciate that. And yes, well, thank you. That's so nice to hear. We tried to provide things very detailed and in layman's, so it's not flying over your head. Please do not hesitate to reach out. Send me an email. I can typically please send me an email prior to calling me. I am more efficient at responding to an email. Personally, I can end up on the phone for like 35 minutes that it would take 4 minutes to respond to an email. So we are happy to be here as your HMIS lead and provide this training. So it all saves time in the long run, right? When we have to go back and make corrections on hundreds of services and hundreds of entries, it takes so much time to correct mistakes than getting the information right now up front, training on specifically what you guys are going to do, providing those materials so you can refer back to them after this. It makes things a lot less overwhelming and really just easier to do and more efficient for the client, so we can prevent and end homelessness, right? That's what we're all here for.
That is it.
That's it.
Does anybody have any other questions? I know we've ran over a little bit, but I don't want to just end without putting that out there. Does anybody have any questions? What are your contact information? So my contact information is Amy, and that is AMIEE at suncoastpartnership.org. And Lauren?
Yes, I put mine in the chat, LAUREN at suncoastpartnership.org. I do want to request, if you have not signed in, this is where we're going to get the emails for your for us to disseminate those materials. So if you have not signed in, I'm going to paste this again. Please sign in so we can get your emails and we can disseminate the materials and this recording to you guys later today. Please just click on that link and follow the prompts. You don't have to answer the questions, but it would be nice. Actually, I do think you have to answer them. They're required. But yeah, any of the emails that we have right here, I'm just going to copy and paste all of them in an email later to send them out to you guys with those materials. As soon as we get off this call, I'm going to start creating the step-by-step for you guys to have something to refer back to. Because this was a bit of information and it's done differently than maybe you're used to. So,
again, Lauren has a basic skills if you'd like to learn a little bit more in depth about those sub-assessments and how to create a new user, again, new household, entry, exit. She also goes over services and referrals as well. And if for those who are with rapid rehousing projects or projects such as like a homeless prevention that requires case management, we also do those program specifics as well to teach you how to record case management within the system, HMIS. And again, that is all through Lauren. So if you're interested, you're going to go ahead and send her an email and she can set something up, and I can be on the line as well if it is a large class again.
I'm going to add that information in the chat for you guys. It was not fun, and it was very having to go back. Oh, I was like, my basic skills wasn't fun. I've implemented a drinking game too. I don't know. Every time I say
so you had quite a few to correct, and you did a wonderful job.
Thank you, Priscilla. Excellent. Thank you. Yeah. So there's some info on our basic skills. Thank you guys for hanging on the line. Thank you, Priscilla. We are happy to help. Work smarter, not harder, right? Be patient with yourselves. See if I have any other. Teamwork makes the dream work. If you don't know, ask someone in your office. They might. And if the both of you don't know, you're probably happy that the both of you don't know. So then you can call us and get the actual answer. There are no dumb questions. The questions that aren't asked are the questions that are often thought about the most. So thank you guys so much.
Have a good afternoon.
Thank you, Amy.
Bye.
Who is it? Sarah and Natasha, if you guys want to hang on, we can wait till everybody's off so I can get into the live site. It's up to you. Thank you, Esther. Thank you, Tracy. Thank you, Jacqueline. Thank you, Jan.
Yeah, I'm here. I'm Natasha.
Great. Oops, darn it. Oh, there. This is you, Natasha Martin?
Yes.
Okay. All right. Well, let's just start at your top level. What client?
I found one that we were trying to enter because he applied
Sorry, hold on 1 second. Let me end the recording.
Sorry.